Thanks for having me here. I'm Scott Safford. I'm a licensed psychologist. I work for St. Charles. I'm going to start my timer here. I work for St. Charles. I'm employed full-time, so I have no other disclosures, financial disclosures. I actually work in primary care as what's called a behavioral health consultant. In that role, I provide brief interventions for a broad range of physical and mental health conditions, and my job is really to teach patients behavioral management skills to complement whatever pills the doctors are prescribing them. So it's a skills and pills model. And obviously chronic pain is one of the conditions we frequently see in primary care. It is something that's frustratingly difficult to treat oftentimes. So what I'm going to be doing today is I'll be talking a little bit about what role psychotherapy could play in helping manage chronic pain. But before I do that, I'm going to spend a little bit of time talking about what psychotherapy is not. I'm also going to let you know that my slides are completely pictorial. I went with the theory that pictures are worth 1,000 words, so we'll go with that. First thing that I want to talk about is I still think there's a fair amount of stigma about going to psychotherapy. So if you're a pain patient and you see your chronic pain as purely a physical health condition, you may not see much value in going to a psychotherapist. Similarly, I think there's a lot of physicians or other healthcare providers out there that may not really understand how psychotherapy might be helpful for chronic health conditions. So I want to kind of talk about some of the misunderstandings about why somebody might be referred to chronic pain or with chronic pain referred to psychotherapy. So one of the things that we look at, try to use the pointer here, psychotherapy is not just to complain about your pain. There is some value in therapy to vent and discuss what's going on, but if that's your primary purpose for going to therapy, it's not been shown to be all that helpful. So that's one thing we look at. Also, we don't want to refer patients to psychotherapy because we think they're crazy. Right? So that's not why we're referring them to psychotherapy. We don't want to refer them to psychotherapy because we think their pain's not real. That it's imaginary or that they're pulling it out of a hat. We also don't want to refer them to psychotherapy because we think it's all in their head. So that being said, even though the chronic pain is not all in their head, we do know that pain is registered in the brain. That's where we experience pain. There are pain regions in the brain that help us experience pain. And so we have to look at the role that the brain plays in pain. Dr. Daniel Claw at University of Michigan came up with a really nice analogy of an electric guitar. Basically what he said with this analogy is that the loudness of the music of playing the guitar is driven by how high the amplifier is turned up, not how hard you strum the strings. So I'd say in a similar way, a lot of chronic pain is driven by how loud the message is in the brain. So it has a similar analogy there. We also know that chronic pain is driven or involves both sensation and perception. This right here is a classic picture from psychology. Some of you may see an older woman, some of you may see a younger woman. The picture's the same. And so in a similar vein with chronic pain, people can have similar sensations, but some are going to experience more pain than others. The other thing I'd say is that even though chronic pain does not mean you're crazy, there is a high degree of overlap with mental health conditions. So upwards of 50% of people with chronic pain meet diagnostic criteria for a mental health condition such as depression and anxiety disorder or PTSD being the most common. Oops, what's going on there? Sorry. So because psychotherapy is focused primarily on education and skills building, it can be provided in a lot of different formats. So the classic format here is individual therapy, which allows for that one-on-one work, really intensive work on the specific issues that the patient's coming to therapy for. But there also could be a lot of value in group therapy. One of the advantages of group therapy for treating chronic pain is the patients can learn from each other. So it's going to be much more impactful for a patient to say, hey, I tried those things you said and it actually helped, than if I say, no, the research says that this helps, right? So it goes a long way. Psychotherapy, because it's skills and education based, can be delivered in a self-help kind of workbook format, what we call bibliotherapy. For a highly motivated patient, they may be able to do this on their own, or it can be done as an adjunct to their individual or group therapy. Treating chronic pain involves teaching coping skills and assigning homework. So one of the things that we know is that with chronic pain, there's a lot of derailment of their life goals. As they're going through life, pain kind of derails them from where they're heading. And so we want to work on developing a set of goals and strategies beyond just, I want to feel less pain. So we want to look at how is the pain impacting their life, what barrier is it presenting to them in terms of accomplishing what they want to accomplish. So we want to help them set specific goals or measure goals that are specific, that are measurable, that are within their control, that are realistic, that have a certain time frame so we could measure whether they're actually moving towards them. Then we could implement problem-solving skills to generate a list of ideas or strategies to try to help them reach those goals. Pick one, try one, see if it works. If it doesn't work, throw it out. If it does work, celebrate that. If it doesn't work, go back to the drawing board, try something else. We also assign homework. An important part of homework is keeping a pain diary. This is really beneficial in terms of tracking the patterning of the pain. If you're doing an intervention, whether that's behavioral intervention or medication or some other activity that they're doing, we want to know if it's making their pain worse, better, or no different. That helps us track whether we want to continue that strategy. So if they're on an opiate and their pain's not getting any better, or they're not functioning better, what's the point of them being on that? We also might want to track their thoughts and feelings about their pain. That really helps us as therapists work with them collaboratively, collaborative problem solving with helping them come up with strategies. This has been mentioned before. A very vital part of pain management is getting people moving, what we call in psychotherapy behavioral activation. We have nice terms for everything. And so we want to get them exercising, moving their body, very important. Another part of behavioral activation is we want them engaged in activities that they find enjoyable, so hobbies and interests and things like that. A lot of times, as Allison pointed out, there's this what I might call kinesiophobia. There's a fear of movement. People with chronic pain, their worlds start to shut down. They stop doing things. And so we want to work on strategies for helping them gradually get moving, using that same concept that hurt does not always equal harm, that we want to use pacing strategies to gradually help them build up, so start low and build slow. So we're just trying to get them more engaged in life. And we have to balance that with downtime, though. There are some patients that I work with that their coping strategy is to be busy all of the time, and so we may actually work with them on scheduling in downtime for them. So one form of downtime is relaxation strategies, which have been mentioned by a few of the panelists. So I have a few different relaxation strategies that I might teach patients. The most basic one is just diaphragmatic breathing, just slow breathing in through the nose, belly expanding, long slow out breath through the mouth. It really helps calm the mind and body down. We could use it for pain flares, for deactivating or reducing that reactivity from a pain flare, but just using it on a regular basis to kind of calm the body system down. We might also use progressive muscle relaxation, which is about systematically going through the body and tensing and relaxing muscles, which really helps calm the body down, but also serves as a distractor, diverts your attention away from intrusive racing thoughts or pain in certain parts of your body if you're focusing on tensing and relaxing another part of your body. We might also use guided imagery, where we have them as vividly as possible picture some relaxing, calming scene, using as many senses as they can, and we consider it like a virtual vacation for them to step out of their body for a little bit. And we might also teach them meditation, so teaching them non-attached observation, focusing on their breath, an object, a mantra, whatever it might be, allowing their thoughts and feelings, whether that's pain or emotions, to kind of come and go, watching them come and go without reacting to them, and then returning back to whatever their focal point is. Sorry. Another important point or component of chronic pain management and psychotherapy is what I call cognitive restructuring. So using cognitive techniques, wrong button. People with chronic pain oftentimes have pain catastrophizing, and that's one of the biggest predictors of dysfunction with chronic pain is having catastrophic thoughts about their pain. This is never going to get better. I can't do this anymore. Nothing's going to help me. So we will work with them on strategies for changing those to more coping-based thoughts to I'm going to do the best I can. Not that pain is great, but I'm going to do the best I can. I'm willing to try something new. So we want to help change their self-talk patterns that they have. It's also very common for people with chronic pain to focus on all the negatives in their life, because there's a grieving process with chronic pain. So we want to work on some gratitude journaling, helping them notice, pay attention to positives in their life, writing them down. Even things, simple things like having a nice dinner, going out with a friend, can help them shift out of that kind of negative mindset. And then we'll also use distraction as a technique to focus their attention away from their negative thoughts and feelings through engaging in positive activities. We will also focus on sleep management. There is a close tie between poor sleep and chronic pain, so we're going to go through a variety of behavioral sleep management strategies to help them sleep better. And then the ultimate goal of psychotherapy is to teach patients self-management strategies to try to help keep them engaged as much as we can, to learn that they could do things despite pain rather than waiting for their pain to go away in order to live their life. And the ultimate goal is to improve quality of life by having them be more active and engaged in things that are meaningful to them and give them a sense of purpose. All right, thank you.